If there's one thing that drives dental practices to distraction, it's dental insurance. And it's really kind of a love-hate kind of thing. Because without dental insurance, many patients wouldn't get dental care. But also companies like Delta Dental are shifting more of that cost burden to the patients. Many people now want only the care that insurance will cover. And the insurance companies are pushing back against even reasonable procedures while making billing much more complicated than ever. After the break, I want to tell you how you can avoid the hassle of dental insurance and earn more than you are now. Stick around. Thanks for watching the Patient Attraction Podcast. I'm Colin Receiver. The current state of dental insurance probably isn't sustainable in the long run. Companies like Delta Dental reportedly give lip service to the idea of better patient outcomes, but they're focused much more on shareholder value and C-suite bonuses. In many ways, dental insurance has become as much or more of a barrier to care than it is a help. Just ask the 1,500 Washington State member dentists who filed a vote of no confidence petition with Delta Dental, also known as the Washington Dental Service, or WDS. They're asking that the WDS board remove the current CEO, Jim Dwyer, who's scheduled to retire next January. Dr. Cynthia Pauley, the current president of the Washington Dental Association, said, and I quote, "Under Mr. Dwyer's tenure, Washington Dental Service, which should be a key partner with our profession in driving better patient outcomes, has instead become a barrier and antagonist to the dental profession." End quote. Now, things have been brewing between Delta and its member dentists in Washington for some time, so this shouldn't come as a surprise. Those dentists are just flat out fed up with unresponsive, profit-focused dental insurance companies. And I would guess you are too. We're used to seeing dental insurance as just a fact of life, but we forget that the horse and buggy used to be a fact of life, that something better came along and the horse and buggy became a footnote in history. Now, there's no way to know for sure how dental insurance will evolve, but there is a way to make it pretty much irrelevant to your practice's success. That is to attract patients who really don't care much about what their dental insurance policy covers. Instead of operating a quantity volume-based practice, try switching to a higher quality fee-for-service practice and attracting better patients. Now, you might be thinking that's impossible. And it's true that making that switch relies on part of your market's demographics. SmartBox has helped hundreds of dentists make that transition to better patients. Dr. Keel from New Hampshire had this to say, quote, "Some of the advertising I've done in the past was more offer-driven, free exam and x-ray kind of things. And when you bring in patients that way, you're chasing them with the next offer, or they're chasing you for the next offer all the way down the line. With SmartBox, a lot of the new patients already are very knowledgeable about what they're looking for. Just the other day, I had a patient come in specifically wanting to talk about implants. He had heard us talk and he was ready to move forward. And that's been really nice to have them already come in pre-educated as to what we do here. Since we started working with SmartBox, we're seeing the quality new patients that I want to see in my practice. Now, you can discover whether you can make dental insurance irrelevant to your practice's success if you choose. Check out smartboxdentalmarketing.com. Set up a free, no obligation phone call with us. We'll discuss your goals, capabilities, your market area, and put together a strategic plan. We'll put together this plan to show you what's possible and the opportunity that we see. You can have less hassle and better dental patients and more enjoyment from both your profession and your life. Join me for our next podcast. Until then, keep moving forward.